If you've been living with chronic back pain, sciatica, disc problems, and nothing seems to help, you're not alone. Many of the people that come in to see me in the clinic, they're frustrated, they're defeated, and honestly, exhausted. They've done pain medication, they've tried chiropractic, they've tried physiotherapy, they've tried injections. In fact, in some cases, they were even told that surgery was their only option. But here's the problem with most of these treatments. They're focused on symptom management. They may be short-term relief, but they don't actually correct the cause of the problem. That's why I've created the BackStrong Framework. It's a step-by-step, non-surgical plan designed to help people finally get the results they're looking for by fixing what's actually going wrong. Chronic back pain doesn't just show up. It builds over time. And in most cases, the real issue is a pattern, not just a disc or joint problem. We're talking about compression in the spine, nerve pressure, inflammation, muscle deactivation. This is like if your house was unstable, the foundation was unstable. There's no amount of patchwork you can do that's gonna solve the problem. The spine is the same way. So instead of treating the symptom, we correct the pattern, the BackStrong difference. The BackStrong Framework has 6 core components, each designed to target a specific part of the problem. Let me walk you through exactly what that means, step by step. S is for spinal decompression. This is where we relieve the pressure on your spinal disc and nerves, especially in the case of a disc bulge, herniation, or sciatica. Decompression creates space, opening up, improving circulation, and reducing nerve irritation. Many patients feel relief in just a few sessions, not because it's magic, but because we're finally addressing the root cause of the pain. T is for therapeutic laser for disc and nerve healing. This isn't average red light therapy. We use class 4 deep tissue laser, one of the most advanced tools available to calm inflammation and speed up the healing at a cellular level. It stimulates blood flow, reduces swelling, and helps injured discs and nerves begin to repair. R is for receptor and shockwave stimulation. This step activates the forgotten muscles, the deep stabilizers that support your spine. We also use shockwave therapy to break down scar tissue and stimulate healing of the chronically damaged ligaments and joints. It's about waking up the body and helping it move in the way it's supposed to again. O is for orthopedic support and spinal mobilization. Here's something that most people miss. Your feet, your pelvis, and your posture all affect your spine. We use custom orthotics when needed to fix faulty alignment. We also apply gentle spinal mobilization techniques to restore healthy movement in the lower back. If your foundation is off, your back will always take the hit. N is for nutritional fuel for disc and joint repair. Healing happens from the inside out. We provide simple anti-inflammatory nutrition guidance and recommend supplements that support disc health, joint repair, and nerve regeneration. You don't have to be perfect, but small changes in your nutrition can help make a huge difference in your recovery. G is for guided spinal rehab and core support. Finally, we rebuild the strength where it matters the most. We guide you through neuromuscular rehab exercises that retrain the brain and body connection, strengthen your core, and prevent re-injury. And if needed, we'll use bracing in the early stages to protect your healing tissue and reduce flare-ups. This is where confidence comes from. When your body feels strong again, everything changes. So what makes the BackStrong protocol different? This isn't a patch. It's not a one-size-fits-all protocol. The BackStrong Framework is personalized, progressive, and designed to work with your body, not against it. And unlike most care models, we address the full picture: your nerves, your movement, your inflammation, your mindset, your stability. That's what makes this work. That's why people see improvement. They walk in with a cane and 3 months later, they walk out without it. Now, I know some people are skeptical, and I respect that. You might be wondering, is this actually backed by research? The answer is an overwhelming yes. There is a strong and growing body of evidence supporting the therapies we use. Spinal decompression has been shown in multiple clinical trials to significantly reduce disc pressure, improve disc hydration, and reduce symptoms in patients with a herniated or degenerative disc. A study published in Pain Practice showed 90% reduction in pain for patients after decompression therapy. What about Class 4 laser? Class 4 laser therapy has been studied hundreds of trials and has proven effects on reducing inflammation, speeding up tissue healing, and relieving nerve-related pain. The Journal of Laser Therapy as Lasers in Medical Science both report deep tissue laser therapy can accelerate the healing at a cellular level, especially in cases of chronic joint and disc issues. These are not fringe treatments. They're modern, well-researched therapies, and when combined in the right sequence, they help to create conditions and that the body needs to heal naturally. So if you've been told that nothing can be done, or that the only thing that'll work is surgery, I want to invite you to call the office. We'll listen to your story. We'll assess the root cause of your pain, and if we believe we can help you, we'll build a plan that is personalized just for you. In the off chance that it's not something we can help, we will let you know the best place to go. Because you're not too old, you're not too far gone, and you haven't tried everything until you've tried this. Call the office today and book your BackStrong consultation. 519-227-1363. Let's take the first steps together.